Dear students, welcome back. In the previous session, we have discussed about the muscles of the posterior abdominal wall. Now in this session, we are going to discuss about the fascia which are related to these muscles, and these fascia is called as thoracolumbar fascia. Okay, so this commonly called as lumbar fascia. So the lumbar fascia is the fascia which is enclosing the deep muscles of the back. So here you can find these are the deep muscles of the back. Okay, and in the lumbar region it is almost in the form of diamond shape, we can see here. Okay, and this layer, this thoracolumbar fascia is made up of with three layers. One is the anterior layer, middle layer and the posterior layer. Out of these three layers, the anterior layer is the thinnest layer and the posterior layer is the thickest layer. Okay, now if you can see the extent of the thoracolumbar fascia, normally the posterior layer, so the posterior layer which covers the loin, and it is continued upwards on the back of the thorax and also neck. It is going to extend up to the nuchal line. Okay, so this fascia is that to the posterior layer of the thoracolumbar fascia is covering the loin, and it is continued upwards on the back of the thorax and the neck. The middle and anterior layers are confined to lumbar region only. Okay, so this is the extent of thoracolumbar fascia. Now we will see the attachments of all these layers. Okay, yes, and in the attachments here also you can find this thoracolumbar fascia, how it is present. So this one is almost a diamond shape. Okay, now so here you can see the deep back muscles which covers the posterior layer. Here we can find the posterior layer here. This is the posterior layer. Now we will see the attachments of the posterior layer. So medially, this is the medial side. Okay, so medially the posterior layer is attached to the tips of the lumbar and sacral spines. So you can find here the tips, isn't it? The tips as well as the tips of the lumbar as well as the sacral spines, and also the interspinous ligaments. So as you people know that, so the vertebrae is having a spine, isn't it? So like that. Okay, so these are the spines, isn't it? In between these two you'll have another ligament that is called as interspinous ligament. So this posterior layer is attached not only the tips of the spines and also the interspinous ligaments. Okay, and this posterior layer laterally it is going to attach with the middle layer, attached to the middle layer at the lateral border of the erector spine. So these muscles are the erector spine. Okay, so it is having three groups of muscles in the erector spine. Okay, so the posterior layer is going to cover this erector spine, and at the lateral border of this erector spine muscle it is going to attach with the middle layer of the thoracolumbar fascia. Here you can find the middle layer. So this is the middle layer. So middle layer of the thoracolumbar fascia. And superiorly, if you see this posterior layer, superiorly, it continues on the back of the thorax where it is attached to the vertebral spines. So normally it reaches to thorax and it is also attached to the vertebral spines and the angles of ribs. So normally on the posterior aspect, as you people know, you have studied the thorax, isn't it? Here you can find the angle of rib here, isn't it? And it is going anteriorly like this. So this posterior layer, superiorly, it continues on the back of the thorax where it is attached to the vertebral spines as well as the angles of ribs. Okay, so this is the attachment of the posterior layer on the superior aspect. Okay, inferiorly, so here you can find the iliac crest, isn't it? Yes. Inferiorly, so this fascia is going to attach the posterior 1/4 of the outer lip of the iliac crest. So I am showing only the schematic representation of the iliac crest. So if you can see this thing, so this becomes the anterior part and this becomes the posterior, and the middle one is the intermediate part. Okay, so this is the iliac crest. So this posterior part, this is the outer lip of the iliac crest, and this one is the inner lip of the iliac crest, and this is the middle portion of the iliac crest. Okay, so the posterior layer inferiorly, which is going to attach the posterior 1/4 of the outer lip of the iliac crest. That means, so already this one is the posterior outer lip which is present mostly at the posterior aspect. So on the outer lip, in the outer lip also posterior side, that to 1/4 of the posterior side, this posterior layer is going to attach. Okay, so this is the attachments of the posterior layer of the thoracolumbar fascia. Now, next one is the middle layer. If you can see the middle layer, yes, so in the middle layer, medially, the middle layer is attached to the tips of the transverse processes of the lumbar region. So here you can find this is the tip of the transverse process. This is the transverse process. So if you can see all the lumbar vertebrae. So for example, these are the tips of the transverse processes. And here you can find the intervertebral disc, and again you can find the transverse processes. So, and the middle layer is attached to the tips of the transverse processes and also intertransverse ligaments. Okay, intertransverse ligaments. That means the ligaments which are attached in between the transverse processes. So the middle layer is attached to the tips of the lumbar transverse processes and the intertransverse ligaments. Okay, so keep it in mind, the middle layer and the anterior layer is only confined to lumbar region only, whereas the posterior layer is continued upwards towards the thoracic as well as the cervical region also. So for that reason only the superior attachment continues on the back of the thorax. Okay, and also the angles of the ribs. So in the middle layer, so here it is attached to the tips of the transverse processes and also intertransverse ligaments of all the lumbar vertebrae. Okay, next, laterally it blends with the anterior layer. Okay, laterally. So here if you can come out, so all these forms the middle layer. Okay, so and this part becomes the lateral part of this middle layer. So this part blends with the anterior layer. Okay, anterior layer of thoracolumbar fascia. Okay, and the quadratus lumborum. So this is the muscle, the anterior layer covers the quadratus lumborum. So on the lateral aspect it blends with the quadratus lumborum muscle. So here you can see this is the muscle, quadratus lumborum muscle, as well as the anterior layer. If you see the superiorly, so if you can see the superior attachment, so this one is going to attach the lower border of the 12th rib, so which is going to attach with the lower border of the 12th rib. Here you can find the 12th rib, so the middle layer is going to attach with the lower border of the 12th rib and also lumbocostal ligament. So, and if you can see the inferior attachment, so inferiorly it is attached to the posterior part of the intermediate area of the iliac crest. So this is the intermediate area. In the intermediate area also, the posterior part of the intermediate area of the iliac crest. This is the attachment of middle layer. Now coming to the anterior layer. So in the anterior layer, medially it is attached to the vertical ridges on the anterior surface of the lumbar transverse processes. So on here the anterior layer is going to attach on the anterior surface, on the anterior surface of the transverse processes of the lumbar vertebrae will have some vertical ridges. So to that vertical ridges, this anterior layer is going to attach. Okay, and laterally it blends with the middle layer. Laterally it blends with the middle layer at the lateral border of the same thing, quadratus lumborum muscle. Okay, superiorly, so this middle layer, if you can see on the superior aspect, it forms the lateral arcuate ligament. It forms the lateral arcuate ligament extending from the tip of the first lumbar transverse processes to the 12th rib. Okay, so we have known that so medial arcuate ligament as well as the lateral arcuate ligament, isn't it? So this thoracolumbar fascia forms the lateral arcuate ligament. Normally we have seen such kind of thing when we dealt with diaphragm, isn't it? So there we find this lateral arcuate ligament. So superiorly it forms the lateral arcuate ligament extending from the tip of the first lumbar transverse processes to the 12th rib. Inferiorly, if you see the inferiorly, it is attached to the inner lip of, so this is the inner lip. So inner lip of the iliac crest, and also it blends with the iliolumbar ligament. So iliolumbar ligament. Okay, so these are the attachments of thoracolumbar fascia. Okay, so this is all about the thoracolumbar fascia. So this is the thoracolumbar fascia is also called as lumbar fascia, and it consists of 3 layers: anterior layer, middle layer and posterior layer. Out of these 3 layers, the anterior layer is the thinnest and the posterior layer is the thickest, and this posterior layer will extend upwards towards back as well as to the neck, whereas these two layers are limited to the lumbar regions. Okay, and in this session we have seen all those layers attachments on all four sides, that is medial, lateral, superior and inferior attachments of all these layers. Okay, so this is all about the thoracolumbar fascia. Okay, in the next session we are going to discuss about another important structure which is related to the posterior abdominal wall, that is lumbar plexus. Okay, thank you.